On the third annual World Pneumothorax Day, the Marfan Trust has put together a quick guide to pneumothorax, a condition that affects a significant number of people with connective tissue disorders. Pneumothorax simply means air in the cavity between the chest wall and the lungs, as shown in this picture. There are several reasons why a person may experience a spontaneous pneumothorax, but around 15% of these are caused by a connective tissue disorder like Marfan syndrome, vascular Ehlers-Danlos, Loeys-Dietz. It can be a clue if an individual doesn't yet have a diagnosis and definitely needs further investigation for a possible connective tissue disorder. Between 4 and 14% of individuals with Marfan syndrome will experience a spontaneous pneumothorax, and it's more common in young men. Connective tissue disorders can predispose people to spontaneous pneumothorax. People are more likely to develop blebs or bullae that can burst. These are air-filled sacs on the surface of the lung or in the lung tissue. There will be abnormal connective tissue within the lungs. And due to the tall, thin body habitus typical of Marfan syndrome, there can be more mechanical stress in the chest and in the lungs. The symptoms of pneumothorax include chest pain that can get worse when breathing in, a cough, increased shortness of breath, or feeling out of breath even when sitting down and resting. Diagnosis is made with a chest X-ray, and as you can see in this picture, the blue arrows show how the lung has collapsed. Treatment varies due to a person's age, medical history, and the severity of their symptoms. Oxygen and pain relief will usually be given initially. If the pneumothorax is small, there may be no treatment needed, and you'll be offered further follow-up with a chest X-ray and a review with the doctor to make sure it has resolved. If the pneumothorax is bigger, the air can be aspirated with a needle. If it's larger and causing more severe symptoms, a chest drain may be needed. Using local anaesthetic, a surgeon places a small tube into the chest cavity to allow the air to drain out. This requires a stay in hospital. If the problems recur, a referral to a thoracic surgeon may be needed to discuss possible surgical options to prevent pneumothorax in the future. Thank you for listening. All our contact details are on this page. If you need help, advice, or support, please do contact us. Thanks very much.